Garrison here, a general dentist here in Columbus, Ohio, and our subject for this video is restorative dentistry. How do we fix broken teeth, ugly teeth, cracked teeth, all of those things? That is the subject of restorative dentistry. That's how we fix all of the above problems. So let's start with the small ones, the cavities. There are at least two different kinds of materials on the market right now to fix cavities, either a silver one or a tooth-colored one. Silver one's called amalgam, tooth-colored one's called composites. Those are a plastic resin. And each of those materials has positive advantages and it has disadvantages. Obviously, the biggest disadvantage for the silver one is it's silver, it's not tooth-colored. However, the other issues as well for tooth-colored materials, among other things, they're tougher to put in. You can't get them wet. Even if you breathe on them heavy with humidity, they can sometimes not stick as well as they would like to. So each and every material has different places that work better than others. And your dentist is going to decide which one works best for you in those places. The second item that happens is suppose your cavity gets bigger and we lose a corner off one of your teeth. You knew you weren't supposed to chew the ice again, didn't you? And yet you kept right on doing it. So, how do we fix that? We fix that with what's called a crown. That's basically an item that looks kind of like a little thimble that fits over the top of that tooth and helps spread that stress out that you're chewing on it with over the whole top of the rest of the tooth so you can't break it as easily. Now, suppose the cavity gets a little bigger, gets into the live part of your tooth, and it starts to get infected, and now it starts to die on us. Now we're into that subject called root canal. You can now stop hyperventilating, take a couple nice deep breaths. It's not nearly as bad as you think. 8 out of 10 folks have no problems with the root canal. The other 10 or 15% do have some mild problems, or some of them are very intense pain-like. However, everyone that you talk to is going to tell you that they had one of those horrible visits, so you know right away that 8 out of 10 folks have lied to you. Why? They like to get the sympathy. And you're going to do it too, and that's okay. That's really human nature. But essentially for root canals, we basically go in and find that decaying portion of your tooth, the part in the middle that was alive that's now dying. We clean that out, and we pack it back up with some rubber stuff to help seal it up so that you can't get any more infections in there. And then we put a big filling in the middle to replace the parts that were broken. And we put a crown on top of that tooth, and that saves your tooth. And contrary to popular belief, that is actually cheaper than any of your next items, usually, to replace that space if we took the tooth out. So, what happens if you did lose a tooth? Suppose you broke it in a way and it had to come out. Then we now have several different options from a restorative dental standpoint on what we can do to fix that space. One of them is an implant. This essentially is just a metal artificial root that is placed in the bone to take the place of your tooth that was there. And then once your bone heals around it, we put a new top on it, and it basically looks the same or very similar to what it used to when your tooth was there. There's a big advantage to using one of these. We don't have to touch the teeth on each side. You can floss this area normally, and you essentially brush it and treat it normally like you do your own teeth. After that, next thing we can do is possibly what's called a bridge. This is where we simply attach a couple of crowns together into one long piece, and your fake tooth is in the middle, and it is all glued in place as well. Now, with this one, the advantage is it's glued in place. You don't have to do anything else other than that, as far as brushing goes with it. But flossing, you need to do some special work to help clean underneath of it. After that, next step down is what's called a removable item. That's going to be a partial denture. That is a tooth that's on a little metal framework, has some clips that help hold it in place. And the advantage of that one is obviously you can take it out, clean it, put it back in. But most people don't like that in some respects because it's not quite as comfortable. But it's a very effective use if that's what we need to do. Of course, one last item that we can always, one last solution to that space is you don't have to do anything at all with it. You can just leave it an empty space. And some folks actually choose to do that. Okay, that is kind of an overview of restorative dentistry. We talked about fillings, materials, crowns, implants, bridges, partials. Those are the kind of things that we use in restorative dentistry just to help get your function back, and as far as so you can chew and keep going your merry way. Thank you.